Hello, sir. How can I be of help today?
Any independent testing of medicines prior to approval.
Wonderful! We'll start with A-list drinks and take it from there.
By the company seeking approval. The EMA only reviews the data the pharmaceutical company presents to them. Based on this, they make a simple analysis. Do the benefits outweigh the risks? The Zyprexa approval was based on 4 clinical trials of 3,000 people over a mere 6 weeks. Trials lasting little over 1 month for a drug that most people will take for years.
And now your bets.
Patients given Zyprexa showed slight symptom improvement over those given placebo or other antipsychotics.
A 6.
There were side effects, but they were deemed
Do you
minor,
want another card?
so the benefits outweighed the risks.
Another card?
Many of Zyprexa's dangerous side effects, such as diabetes or sudden death, didn't show themselves during the trials. The real dangers only became clear after Zyprexa was introduced into the population at large. This is how it works with nearly all medicines on the market.
It's time to play.
It is only after they have been approved that the real side effects are known.
7.
So
Would you
we,
like another card?
the consumers, are unknowingly the guinea pigs for new medications.
17.
It took me 2 years to get an interview with the EMA, but I did get one with their senior medical officer.
Let's begin.
Where should we
13.
place the responsibility when something like this happens? And I mean, there's thousands and thousands of people who have died.
Some
Shots of 14.
hardship, some damage to patients, as regrettable as it may be, as it is unavoidable. Now, having said that,
I mean, it's unavoidable.
Situations where someone doesn't live up to their responsibility, whether it is the doctor or maybe even the patient themselves because they take the wrong dose or they take it irregularly and undisciplined, or whether it is the pharmaceutical company or the regulator because they don't pick up signals, that may happen. But it is very difficult to say there is in general this responsibility to be met. We regulate medicines. We do not regulate the practice of medicine. It is a judgment call that has to be taken by regulators in the best interest of patients. We also have to be
You don't
honest.
know the risks.
You never know all the risks.
Well, then how can you say this risk-benefit balance then? It doesn't make sense.
The known
You don't know.
benefits and the known risks. We have to be honest. And I think we all have to accept as a society, whenever you bring a drug out, there will always be unknowns.
So the EMA makes a judgment call based on benefits versus risks.
Wow.
How did they measure the value of the lives that would be
We
lost?
have 9.
They didn't.
Another card?
They didn't care.
That's
It was
19.
money.
Dealer wins.
It's
The
all about
pharmaceutical
money.
lobby in Brussels is powerful. They declare to have spent over 40 billion euros lobbying in 2015.
All bets are closed. It's time to play.
The pharma lobby enjoys easy access to decision makers and offers expert advice on EU laws and the drafting of regulations. And after years of trying to get an interview with someone from the industry, I finally succeed with the head of Europe's Pharmaceutical Lobby Association, FPA.
We still are not transparent enough about how we go about things. The fact that medicines are developed in partnership.
Okay,
When you
bets
see
are
on
closed.
TV,
Let's
you see
begin.
usually a man in a white coat talking about how this was developed.
12.
The fact that there's a company
That's
behind
8.
and the government
Do you
is
want another
involved as
card?
well. This is not known. You think that this is some researcher doing this, but a researcher at Stockholm University or whatever doesn't have 100 million euros lying around for clinical trial. No. So all of this is coming from the
That's
industry.
17.
Yeah. So let's go back to the system of getting drugs approved. If we look, for example, at the antipsychotics, how could it have been approved in the first place and not discovered that prolonged QTC was a side effect and that sudden death was a side effect?
Sometimes we just simply don't know. Sometimes we find out rare there's only 50% chance it will work. Why is that? Is that because we are stupid? No, we're not stupid. The regulators are not stupid. The doctors are not stupid. It's just that we don't know enough about the science. We don't know enough about this disease. This is both the beauty and the frustration with science, is that you have a study that concludes this, and then you have a study that concludes this. I mean, if you have taken all the advice we get on nutrition, are you a little bit lost, as I am? Salt, good or bad? I don't know. Now, what I'm happy about is we have these regulatory agencies that really control the products and what you can say about them, okay?
87% of EMA's budget is funded by the pharmaceutical industry. So the controllers are paid by the very industry it is meant to control.
No. How is that possible?
The people who are supposed to control the public good to make sure the medicines are safe and they work, many of them worked for the pharmaceutical industry themselves beforehand, or when they leave their jobs will go directly into the pharmaceutical industry. This happens with the FDA in the United States. It happens with the EMA, and this is scandalous. So, unless we have independent controllers, the whole scientific methodology of whether our medicines are efficacious,
Y'all owe money.
whether they work, whether they're safe, has been broken, and we're dealing with a broken system.
You're waiting.
What's going on, ladies? How y'all doing? What y'all name is? Well, my name is...
I think Renata's deepest sorrow was that she was unable to be a mother to her daughter. On her daughter's 4th birthday, my aunt and I went to visit her. The nameplate on the door had both Renata's and her daughter's name. A pair of children's shoes were in the hallway. Renata is happy to see us, and she hasn't forgotten that it's her daughter's birthday. Happy birthday to you. Happy birthday.
Hello, sir. How can I be of help today?
Renata's bought a birthday cake.
I'll send that round right away.
She sets the table for the 3 of us and her daughter. She cuts the cake and puts the first piece on her absent daughter's plate.
Hey, friend. It's Madrazo. The older, more handsome one, huh? There is someone who wants to meet you, and, believe me, you want to meet him. You think I'm into some bad stuff? Let me tell you, this guy has a finger in every pie in Los Santos and beyond. Meet me at LSIA, and, if you embarrass me in front of him, I will kill you.
Scientists estimate at least 200,000, but I keep finding reports on that. The FDA, the Food and Drug Administration,
Hey, partner.
is the regulator in the U.S.
Done. Shit, rise on the way. Okay, the networks are down, the equipment is ready, and we've crippled their supplies. Mrs. Rackman has written our check and given us the green light. We're good to finally move on that submarine and stop this threat once and for all. When you're ready, get your crew together and head back to planning.
Nervous and insecure about exposing what he had experienced while working at the FDA. He tried to blow the whistle to Congress, but his efforts were met with threats. Do you feel that in your time as a drug reviewer, there were things that you saw that actually could have saved lives.
Absolutely. Absolutely. I was at the FDA for 10 years, and at one point I calculated that I caught a safety issue on average once every 6 weeks of some sort. And I had a number of safety issues, major safety issues that had been repeatedly dismissed. There's a lot of money. There's a lot of money. It's a shame. I saw a lot of things my time at the FDA. There's a lot of good people. There's a lot of good people. You don't see good people getting promoted.
Seems like I take a pill for every